speaker is Loretto Grogan, and Loretto is going to speak on telehealth. Loretto is the National Clinical Information Officer for Nursing and Midwifery for the HSE. She's working in the NMPHN. Loretto believes that e-health can make our lives better, supporting the implementation of connected digital health. Loretto speak today on telehealth. Welcome, Loretto. Thank you.
Okay, good afternoon, everybody, and thank you for the opportunity to present today. My name is Loretto Grogan. I'm the National Clinical Information Officer for Nursing and Midwifery in the HSE. It's just to start by following up from the previous speaker to acknowledge the amazing work that nursing and midwifery colleagues have undertaken and the capacity that nurses and midwives have to adapt to a changing work environment. And we really have seen a changing work environment in the last number of months. We have seen lots of changes in terms of how we work, how we interact with our patients, and how we interact with our colleagues. So today I'm just going to talk about telehealth. I'm going to touch on what telehealth is. It's been a sprint and a marathon. I'm going to talk about the infrastructure supporting telehealth. I'm going to talk about implementation, supports, evaluation, and take any questions. And again, it's a whistle-stop tour of telehealth. So telehealth, as described by the World Health Organization, is the delivery of healthcare services where patients and providers are separated by distance. It uses ICT for the exchange of information, for the diagnosis and treatment of diseases and injuries, research and evaluation, and for the continuing education of health professionals. From a patient perspective, it's to provide care to clients and patients remotely and safely to help them manage their health and receive the services they need. So again, there's been a number of globally documented advantages and disadvantages of telehealth, mainly being patients have increased access to care, patients avoid risk, patients save time, patients save money, patients can manage chronic conditions better, and nurses have more flexibility. Again, a number of disadvantages have also been recognised. These are some visits just need to happen in person. Telehealth is just not suitable for every patient. Some patients experience barriers to telehealth, such as not having the appropriate devices. Connectivity can be a significant challenge, and we have seen this in Ireland in a number of remote areas where patients they don't have that bandwidth to connect. And also, telehealth can be hard to reach certain groups of patients, particularly disadvantaged groups or particularly socioeconomically disadvantaged groups. And telehealth is a relatively new concept. Technology is improving each year, and with the improving technology, there's the improving infrastructure. So again, I'm just going to start to talk a little bit about how it began. It began as a sprint. The pandemic triggered an unprecedented demand for digital health technologies. There was an instant loss of capacity in all healthcare settings, loss of space, time, people. Dramatic changes in physical health infrastructure were required, and telehealth solutions were rapidly deployed and implemented across the health service. Just in terms of infrastructure, there's a National Telehealth Steering Committee that's chaired by Maurice Farnan, and that is responsible for overseeing the implementation of telehealth nationally. Under that committee, there were 3 working groups: remote monitoring, VideoEnabled care working group, and online support and therapies working group. So I'm just going to talk through what each one of those groups is responsible for. First one I'm going to start with is remote monitoring. And like I said, there's a working group and it's representative of colleagues from service, from the office of the CIO, from business, from health innovation. So the role of the remote monitoring group is to undertake a review of the current international evidence base in relation to the implementation of proposed remote patient monitoring solutions. That's almost complete. To develop a process to review anticipated future developments. And again, this is a really important role to have a horizon scanning view of what's coming down the line. To conduct a rapid review of lessons learned regarding technical, organisational and human factors in the implementation of remote monitoring solutions currently in use in Ireland. And again, that's really important that we learn from what we've implemented. and to provide advice for the examination of the clinical and technical suitability of emerging and implemented remote monitoring solutions. So again, that's providing advice in terms of standards, what we expect to be in place for devices or for remote monitoring devices that patients are going to use and that staff are going to implement. And to establish an accessible information resource hub where we can have information and also those standards and other relevant information to implementation. There's also a video-enabled care working group. The core role of that group is to develop a national vision and strategic plan for the implementation of video-enabled care, to provide strategic direction and guidance on the implementation, to advise on requirements and priorities for video-enabled care deployments to support both acute and CHO services, to oversee, monitor and report on video-enabled care implementation, and to advise on matters relating to environmental considerations, for example, barriers to uptake, technical considerations, protocols and guidelines and standards. The third group is online support and therapies. The role of this group is to consult with a range of health and social care professionals and other relevant stakeholders regarding assessments of needs and opportunities for innovation, to undertake a mapping exercise of what currently exists within the public and private sectors, including private insurance companies. That's just been complete. To carry out an options appraisal outlining pros and cons of each tool resource based upon agreed evaluation criteria in relation to how they align to relevant frameworks, identified needs and clinical priorities. And to present a final report recommending a range of resources and tools for online therapies and associated costs. And just to talk about telehealth and finding its place, and this has probably been, the last number of months has been a significant opportunity, but also a challenge in terms of telehealth. So finding its place, so the general advice that has been given is telephone first, video-enabled care or telehealth second, and then when phone won't suffice, for example, if there's you see the patient, they've got high respiratory rate, they're anxious, the consultation isn't working out, then in person is the third. Again, I'm just going to talk a little bit about implementation. And one of the key things is, does it fit with your current workflow? So how will telehealth, what will it do? How will it be implemented in the clinical area? Will it be of use in your clinical area? Will it be of use to your patient cohort? Will it be effective? You'll have to develop a new telehealth care pathway. So how will it fit into your current workflow or your current care pathways? Identifying clinical champions to champion the use of telehealth. And equipment. Equipment is a significant consideration. Do you have the equipment and the connectivity to implement telehealth? And again, ready for telehealth? Have you looked at your case needs? And again, this is a significant consideration, clinical use cases. Is it relevant for the clinical use case? Have you identified the clinical use case? Have you looked at your business processes, all the tasks and activities that will be involved in terms of telehealth and making those happen? Again, the environment has been a significant consideration. Do you have room? Do you have access to a quiet room? Do you have the hardware? So that's equipment such as devices, web cameras. Do you have the software? There are a number of platforms in use. And do you have the network? Do you have the connectivity to enable the implementation of telehealth? I'm just going to talk now about support for implementation. And this is with a specific focus on video-enabled care. So provision of a ready-to-roll package. So national procurement, so just in terms of this component of telehealth, national procurement and GDPR requirements are complete. There are licenses in place and funded by the Office of the CIO from COVID-19 capital monies. Provision of clinical and organisational governance guideline and documents. So just to mention there actually, and apologies, the Attend Anywhere is the platform that has been procured by the HSE and also WebEx. And the DPIAs and other GDPR and security and privacy requirements have been completed. Again, there are a number of clinical and organisational governance guidelines documents in place to include a readiness assessment document for each organisation. There are daily training sessions with questions and answers available. And there's also daily live demos with Q&As available. There's a central system administration and configuration guidance. We've ensured that this is supported by the National Service Desk, so if colleagues are having challenges, and advertising and support resources. And there's also been the formation of a supportive collaborative ecosystem, and again, we're learning every day. So that is composed of experienced and enthusiastic Office of the CIO and Empower team willing to share. There's also experienced nursing and midwifery planning and development project officers who've got kind of key existing nursing and midwifery relationships established. Strong encouragement of viral adoption and information sharing, timely issue resolution, escalation process, and a priority on shared learning and openness, and putting the infrastructures in place such as webinars, websites, etc., to enable that shared learning and openness. From a nursing and midwifery perspective, the ONMC has established a nursing and midwifery telehealth advisory group. The core function of that group is to develop clinical use cases where telehealth will impact, to facilitate the evaluation of the implementation of telehealth on patient care, care provision, and the broader workforce, to act as a link into services, to facilitate the right solution going into the right service for the right reason, to assist with the business as usual activity, to act as a go-to group for colleagues to refer to, and to have a horizon scanning view in terms of integration and how, if there are opportunities for integrated care between CHO and acute service. Just in terms of an evaluation, we have conducted a two-stage national survey has been developed in consultation with all health professionals, disciplines, patients and clients. And that's with the purpose of improving the quality of digital solutions. Both of those services were piloted before they were implemented nationally. The first stage was a survey of healthcare professionals to ascertain their views on solutions offered to date. And the second stage is a survey of service users to include an easy read version. So the first stage survey was closed the week before last, and we had 719 responses to that survey from healthcare professionals. The second survey is closing this week, and to date, I think we've had over 350 responses from patients. I'll give you an overview of the 5 key messages from the health professional survey in terms of usage, expected outcomes, level of technical difficulty, advantages and disadvantages, and level of satisfaction. So just in terms of usage, healthcare professionals from many different disciplines are using a range of digital platforms to include Attend Anywhere, Blue Eye, T-Pro, Salasso. They're using WebEx, Teams and Zoom for group work. And just in terms of figures, so Attend Anywhere, last week there was 3,300 consultations carried out on Attend Anywhere, and there was 517 on Blue Eye. So in terms of expected outcomes, 61% of healthcare professionals felt that virtual consultation met or exceeded the outcomes they would expect from a face-to-face consultation. However, 39% felt that outcomes were less or much less than expected from a face-to-face consultation. So level of technical difficulty, 60% of respondents experienced relatively little difficulty with technical issues. However, 40% of service users experienced a level of technical difficulty using video-enabled care. So in terms of level of satisfaction, when asked if they were likely to recommend virtual consulting to a colleague, 87% responded that yes, they would be likely. Advantages and disadvantages to telehealth. Some of the advantages were that healthcare professionals felt they got to see more clients. They were enabled their consultation, they didn't have to wear masks, so they could actually see, the communication, and they found it advantageous using a virtual platform. Some of the disadvantages obviously were connectivity dropped, so there were challenges during the consultation. And then another kind of key disadvantage was that if the patient required diagnostics or was possibly too unwell, that they would have to, that was a disadvantage in that obviously you couldn't actually examine the patient and they had to go to a service. So again, just in terms of the evaluation, the initial findings are largely positive. However, not all healthcare professionals experience the outcome they would expect. And again, we have a lot more analysis to do on both of the surveys. And like I said, we will be disseminating that report over the coming weeks. I guess to conclude, before COVID-19, there was minimal usage of telehealth. We've experienced a sprint of implementation, but now we're getting into that marathon stage where we want to look at sustainability, we want to learn, we want to get this right. The ongoing, the 3 working groups, that work will continue. We're constantly learning. We are trying to be agile and responsive. Again, there's been significant learning in what we've got right, and significant learning in what we haven't got right and what we need to change and improve. Supports. The support network to support implementation is growing. 19 posts have been approved nationally from GM grade down to grade 5s to support the implementation. Hardware, software networks, work is continuing on that. We've got a significant funding for hardware, and colleagues in the Office of the CIO are constantly looking at networks and software. Procurements will be starting, national procurements for some of the remote monitoring and the video-enabled care solutions. And just to say, a lot has been done, but we have a lot more to do in this space. And nurses and nursing and midwifery colleagues they really have embraced the implementation in a number of services and have been leaders in implementing in this. But like I said, we've a lot done, a lot more to do. Thank you, colleagues, for the opportunity to present. And I'm happy to take any questions.
Loretto, thanks very much for that very interesting presentation. I think even it's amazing how times have changed. The concept of speaking to a patient without a mask has become alien to us in the acute hospital setting. It certainly ties well in with Sláinte care, and I suppose it must be very reassuring for patients to have access to be able to ask questions about anything they want. It must be very reassuring for patients.
No, and there are particular patient groups, particularly in the chronic disease category, that really have benefited. I was just talking to an advanced nurse practitioner colleague during the week who works in the area of haematology, and they have really they have found implementing telehealth really beneficial to the patients, but also to themselves in terms of being able to connect in with their patients and limit the amount of time those vulnerable patients have to spend in acute services.
Excellent. Thank you so much.
No, thank you for the opportunity.